Hello, welcome to Below the Skirt with Tamara Green. My name is Tamara Green, pelvic rehab therapist with Below the Skirt with Tamara. We are here today talking about prostatectomy in the eyes of a man. In the eyes of a man, we have a special guest, Reverend Odell Cleveland. He is here to give it to us in his eyes. He is not had his prostate removed, which is a good thing, but he's going to give it to us in the eyes of how men see it. Because I bring it to you guys every week, but I'm a woman. So we want to hear it from him. So the biggest question that we have is so after you've had a man has had their cancer removed, what is the biggest fear that any man will have when it comes to this procedure and what happens after having the prostate removed?
Well, first, thank you for allowing me on as a guest. But usually when men talk about prostate and prostate removing, the biggest fear that they have is, can they have an erection, down the road? That is what men usually deal with from that perspective. And the key is, how does one stay alive, though? That's more important. But men ask the question, will they be able to perform with their loved one, that kind of stuff. So that's what you usually get.
Okay. All right. As you catch your phone, there you go. So
Sorry
I
about
think
that.
that no problem. Hey, it is what it is. So I think the biggest concern that men have is what? They're concerned about, is their manhood going to be not be a semi truck, but is he going to get back to that Mack truck? I think that's the biggest component, right? That's what they're concerned about. They're concerned about, how much incontinence am I going to have? And we're going to dive deep into this in a little bit. But I think that is the biggest concern, is what happens to my sex life? And
Yeah,
are those conversations? Go ahead.
Yeah, you're absolutely right. However, I think to the point of the truck, the Mack truck, and all this good stuff is this. We feel that we talk about a male anatomy, which is
Right.
officially known as the penis. The penis has two main functions. I'm sure someone would say, no, it's more than that, Odell, but two. First and foremost is to let urine come through, right?
Right. Right. That's right.
Secondly, then it's talking about sexual function, reproduction. So when a male child is born, a male child is born with a penis. A male child has to be potty trained, because first and foremost, it's about urine. It's about urine. It's a
Yeah, that's
function
right.
of urine. And as a man go through his whole life, and we'll talk about this, okay, puberty, then it started talking about sexuality, then it started talking about size, and then all that stuff that we get so enamored with. But we want to make sure the primary focus stays the primary focus, not the secondary focus. Now, I'm no fool. I'm a man, and I understand sex, and I understand the importance. I understand all that. But once we go through that stages of reproduction and later on in life, it's still there. It's still the primary function, and it's about urine. I'll say this, doctor. An old man told me once, and now I'm 60 years old, so I'm an old man. He said, "What once was my pride and joy," talking
Mhm.
about penis, more or less, "is now just my water boy." So what he was saying is this: once what I was proud of, I'm the man, Mack truck, all this kind of stuff. Now all it is my water boy. Now I'm trying not to pee down my leg. And it goes back to the original primary function. It's there to allow you to let urine out.
That's right. So, and like I said, it has two functions. It's to urinate, and also the prostate's job is to help with it produces the fluid for semen. So if some of you didn't tune in last time, I'm going to quickly go through some anatomy and we're going to hop back into it. But every male has a bladder, right? There goes the bladder, right? And then under that bladder, we have the prostate. That prostate is a kickstand. With that, behind that, we have the rectum. This sits here. So that's where the doctor goes in, he does that assessment, he goes in through the anal component, which y'all hate doing, but that's how he's able to check the prostates here. Now, these sit within the pelvic floor here, a set of muscles. Now, if those muscles are weak, you're going to have a lot of leakage. So when we take the prostate away, bloop, bloop, we're going to take this rectum to the side, you don't have your kickstand anymore. And that kickstand is what gives y'all a support. So y'all cheat like women we have to use our own pelvic floor, not the leak. Y'all have something to help y'all up. We always helping y'all for something, right? But now we have to reteach you how to do it. But I'm not going to talk specifically on what pelvic therapy is about, because that's going to be on the next live that I do next week, Tuesday. And we're not going to go all the way specific when it comes to sexual function, because on the fourth session, it will be on getting your groove back, me telling you how you can do that. But in the eyes of a man, what I have noticed with men that I've worked with, they have, the biggest thing is a sense of embarrassment. They're embarrassed about not being able to hold their bladder, control their urine. They're embarrassed that, hey, what I bring to my household when it comes to my woman, or whatever you decide to do, I can't bring all of me, because a lot of men feel, and this just, I don't know, just the biggest thing, they walk in the office is like, hey, how can I be the Mac Daddy when it comes to my wife or my significant other? Or if you don't have a significant other, you may just be, hey, we straight talk. You may be pimping it out there, right? If that's the case, how can you still do what you want to do? So give it to us in that perspective, the feelings, that talk that you would have with yourself and your significant other, or whoever you're going to be dealing with, about how you may not be functioning to the capacity that you may have been prior to.
I'm gonna give it to you straight, like 9:15. So let's do this. First and foremost, all men can get prostate cancer. However, statistics show that Black men, African American men, usually get prostate cancer more than others. And statistics show that African American men usually die from prostate cancer more than others. So the key is, before the Mac Daddy and the groove on, if one gets checked, and you mentioned how one would check the prostate. The prostate is about the size of a walnut. That's it. So for someone to get checked, the doctor, him or her, has to take their finger and go up our anal cavity, which is AKA our butt, and go in there and put their finger up there and touch and squeeze the prostate to see if it's hard or soft. That's the physical part of it. The other part of it is PSA. When you start dealing with PSA and blood tests, and the PSA blood test is nothing but a primary screening, and it tests just to see the prostate specific antigens, PSA. Right. And that's something that's the cancerous or non-cancerous parts of the tissue in the prostates will put out. So that's simple. So the key is, how, as African American males, why don't we get checked? Why don't we do these things? And I would like to say that because of some of our culture, because of the whole thing on homophobia in our community, because now we're talking barbershop talk, but barbershop talk and beauty parlor talk is straight as 9:15. And we're trying to save lives. We're not trying to embarrass someone. We're trying to save lives. So if you could get checked, and it's not that you are whatever, because some man sticks his finger up your behind. Nobody's playing with your behind. Folks trying to save your life. And I think that's a mentality in our community as Black men. Sometimes it's like, nah, I ain't let no man. No, yes, you are. Yes, you are. Because as men, and redefining what manhood is taking care of ourselves, to take care of our family, to take care of our children. And the fact that if we can stay strong as men, that's how I look at manhood. Now, I'm not naive about sexuality, the enjoyment of making love to your loved one, all the self-worth and how a man feels about himself when he can Mack truck, because that's men's health. Right. And so that's how I see it from a man's perspective. And as a Black man, we don't have to die from this disease.
Right. So can I insert something?
Yeah, definitely.
So, and I think just as because you're coming from a black man, but I think also as well from men overall. I think Black, white, purple, orange, gray, however, those things, that's an area that a lot of men don't want to touch, and it will save your life. So the biggest thing is knowing what your levels, making sure your levels are less than 4 less than a 4. You want a less than that, but that keeps an eye. I just want people to know as well, when you get over the age of 60, more than 50% of the men have a prostate enlargement. They have a prostate enlargement. Thank y'all for tuning in. If you have comments, make sure you drop it in. I will definitely approach those at the end, but I will add those so we can make sure we can stay focused. But more than 50% of the men have an enlarged prostate. Now, what are some of the signs? Say you say, I'm not going to get tested, and I'm going to use my situation as an example. My father's dad, which is my grandfather, he passed away from prostate cancer. Now, he refused, based on my dad's telling, he had prostate cancer. He refused to go and have the procedure. By the time it was time for him to be able to have the procedure, it was too late. So my grandfather died of prostate cancer. So that's something we're stickler in our family because it is in the history, but you can be proactive. And some of the signs that you will see if you are noticing you are having an enlarged prostate, you'll have frequent urgency to go to the restroom during the day, at night, also having a painful ejaculation, painful pelvic region. So anywhere between that hip bone from left to right and down towards your penis, all that area is your pelvic region. So painful areas in those regions. You may be having dribbling when you're urinating. So it's almost like when you're urinating, it's like a trickle, 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 trickle. And then when you want it to stop, it's still kind of having a residual flow. Also, too, you may have been painful in the groin area, the butt area, the hips area, the lower pelvic region, the lower abdominal. Those are signs something is going on. And listen to your body. Don't be embarrassed. You taking that step will definitely, it can save your life and prevent things in the future. So another thing I do notice, men, I can see when they come to my office, y'all's patience is not there. Y'all want it done now. Y'all want to be fixed at the moment of a blink of an eye. Y'all want it fast. Y'all want it fast, just like y'all want sex fast. We're going to be straight up with y'all. That's how y'all want it. But y'all got to be patient. So I do notice, and you can come from a male, even though you have not had your prostate removed, patience. That's hard with men, and patience. Why do you feel that maybe that's the case?
Well, again, we're going to save some lives by being on this show today because we're taking the stigma away from not talking about this. Now, talk about patience. You are a professional who examines men's prostate or pelvic floor. So, case in point, you take your fingers and put it up men's rectum to touch the pelvic floor like you're sitting there like a piano playing on the keys of a men's pelvic floor. Now,
that is not how I do it.
But who wants to? I'm not going to take my ashy behind and bend over there and allow you to play pianos inside my rectum. That's not so patience. You're right. Now, back to the point of we want it to work again the way it used to work. First, let's say congratulations to the men who had enough wherewithal to get examined, found out that they had prostate, went along with the surgery, because a lot of times men don't go along with the surgery. So now, once that's over, because the process is the male penis gets hard by blood, first the nerves, and blood going through the arteries or the veins on the outside because it's a muscle, and it gets hard because more blood is going in that's coming out.
Right.
When sometimes, according to the severity of the cancer, nerves are cut.
That's right.
Arteries or blood vessels are cut. So just like any other injury, just like my Dallas Cowboy fans who saw their quarterback go down, you have to get rehab. How does one rehab one's penis? How do one rehab one's pelvic floor? How do one rehab one's psyche that what used to be my pride and joy is now just my water boy? And I can't even control peeing down my leg. So you say you don't have patience? And we're saying patience, we're tired of peeing down our leg. Patience, our manhood was caught up in how can we make love to our wives or our woman, our significant other. So patience is a lot riding on that because psychologically, emotionally. I don't want to say spiritually, but that's part of it. So as we redefine what being a man is, as we redefine manhood, because remember what we're talking about is the human anatomy. That's all we're talking about. But the male penis was first designed for urine. Secondly, it develops into reproduction and everything else. And once that stage of life is gone, it's right back to what it's been, because it never stopped using to urinate. It never stopped.
So I
From
will
day
say,
one to the end.
but I will, and like I said, I'll touch on that next week when I talk about pelvic therapy. And the week after, when I say getting your groove back, I'll give you more specifics because it doesn't have to end there, right? I always say things don't have to be written in pen. Sometimes we operate in pencil. And that's something and I look at that because we feel like, okay, this is doomsday. My Peter, I call mine Virginia, our vaginas are Virginias, is doomsday for Peter, right? And it doesn't have to be. We have to find other ways to modify, to be able to get back to the quality of life. If that's when it comes to our sexual health, when it comes to voiding with urination, if it comes to just quality of life, getting back. So we'll talk further about that. And I think the feelings is the biggest thing, is that, like, you hit a big point, is that mindset. First of all, and as I've talked with men who have already had their prostate removed, they say getting the cancer out is the first thing of being able to free yourself. It's like, okay, first of all, I want to expand my life a little bit longer or a lot longer. Let me get this barrier out the way. Now, once we do that, now we have to approach that. So great. That is a question you should have. You should have that conversation with yourself first, because it's your body. It is your self-care. But then you have to have that conversation with your significant other, because it's like, okay, how are we going to re-engage ourselves when what I bring to the table is not what I'm not able to bring to the table what I can. And again, we'll talk about that later. So I think the biggest thing is just knowing how we feel, how long it takes, because it's shocking. The disconnect, and why I'm so adamant on doing these lives, because when men come into my office and they've had those surgeries, a lot of them are lost. They're lost. I didn't expect this, Tamara. I didn't know it was going to take this long, Tamara. And so pretty much rehab, we're the cleaner uppers. We just be sweeping up what's going on. But once the doctors have done what they needed to get the cancer out, we are there to finish it off. And it's just like you say, working out. Men, y'all understand that talk, football talk, sports talk. It's like bench pressing, right? That's the same thing with the pelvic floor muscle. We got to be able to lift that muscle. If we engage that pelvic floor, that'll definitely work on strengthening so you won't have leakage. But at the same time, bench pressing that muscle will strengthen it to do what it needs to do. And I do notice for my men, when y'all come in, y'all are ready to work. If I say do 20, y'all do 55. If I say do it like this, y'all do it like this. So the recovery is good if you do your part. But there, with anything, you can go into surgery and it may be a 50-50 chance or 70-something chance. Like, there's always that point of time knowing it may not fully come back. But you have to decide, well, can I still have a quality of life and live? Or I'm going to have some of this quality of life and I'm going to die. So I think that's the biggest thing. And you mentioned it too. It's like men have, what I've noticed is like, how can I get back? How can I get my groove back? Because I don't want my wife or my sick girlfriend with somebody else. What is your opinions on that? Because as we got about 5 minutes, I definitely want to keep us within a time frame. What's your opinions on that?
No man, in my opinion, ever won't even think about their woman, their wife with another man. Nobody want to do that. I've knew men who, this whole new term, erectile dysfunction, because of the prostate, they saved their life, but now they're getting back. I knew men who took the blue pill. I knew men who took the cream, men who used shots, men who even had surgery where they put,
Yep, they put something. Yeah. I'll talk about that later.
Yeah. Yes. Mm-hmm. So men are very, when it comes to sex and lovemaking, men are not crazy about it, but exactly. But they like everybody having sex every day, hanging from the chandelier anyway, so it's not that, it's that barbershop talk stuff. But we're trying to save lives. And I just thank you and what you're doing with your show and the whole idea, because what some people may or may not know is like, okay, we are afraid, but we're not afraid to go, not afraid, we're ashamed. We're not ashamed to get help from no place else. We're not afraid to get help from any place else. As men, we have to stay alive, because guess what? If we die, you're not having sex anyway. Nobody's having sex with a dead man, and somebody else gonna be with your woman. So come on now, come on, let's keep
There
it
you
real.
go.
Let's keep it straight, like 9:15.
9:15. Even though you're a reverend, you are still a man.
Even though I'm a preacher, I'm still a man, and that's it. And I don't want nobody else with my woman, not at all. Amen.
Period. Blank. There you go. So again, we thank y'all. When it go, we thank you for tuning in. The biggest thing is knowing not to be ashamed. There is some frustration. This is a process. It's a journey. It's a journey, but it's a journey to say, hey, first, enough is enough. I want to live. Have the procedure, but know there's something, there's rehab after. The rehab is what's going to help you get to where you want to faster. But we only can go but so fast because it takes time for those nerves to regenerate. But it will allow you to be able to get stronger, get faster. It will allow you physical therapy, pelvic floor physical therapy is not just a physical thing like any physical therapy. It is a package. It's a mind, it's a body, it's a soul, it's everything. And if you do your part, you will have the results. But we have to be proactive. You've got to get a team of people, not just your primary care, not just your surgeon. You need a pelvic physical therapist, because the things that I know now as a woman, I wish I knew when I was postpartum. I didn't do any of that stuff. I didn't really know. But now that I know, we are needing to have these private conversations in these public forums. And this will help you and realize, if you're not sure, join some prostate support groups. Support groups are there. They're there to help. So again, let me see if there's any questions that people may have. Thank y'all for tuning in. Thank you for those who say there's a good information. But we do want to also bring some attention to you, Mr. Odell, Reverend Odell. You are a recent, another book that you wrote, right? Another one. But the recent one is It's My Turn Now, Caregiving 101. Can you give us about 30 seconds of what it's about?
Yes, it's just about caring for people. And the thing is, the tie here is the fact that if you go through prostate cancer surgery, someone's going to have to help care for you. So that helps in that way too. And at the end of the day too, having that talk with one significant other, if I cannot be, quote unquote, the man I used to be in the bedroom, then I need to talk to my wife. But the good thing about it is I've been getting prostate examinations for the last 10 years, so I could have a benchmark. So if something's going wrong or something starts, then guess what? I want to be the first to know. And those are conversations. If someone asks me, would you rather have sex or live? Then I want to live. Prostate, be gone. I want to live.
There you go. There you go. Well, again, we thank you for coming. Hopefully, would you be willing to come again? Okay, well, thank you. Hopefully we'll put something together, and hopefully this was informative to you, you guys. If you have any other comments, concerns, drop it in, send us a message. Our Facebook page is Renewal Rehabilitation Center. If you have had this procedure done, or you are thinking of having this procedure done, and you have questions or concerns, my name is Tamara Green. I'm a pelvic rehab therapist located in the Charleston area. The company that I work for is Renewal Rehabilitation Center. And with that, I will be able to schedule a free 10-minute consult with you. Because a lot of times you don't know what you're getting into, or you may have some questions, concerns, and you just don't know. Schedule an appointment. We'll put our information in here, and you can schedule an appointment. Like I said, go to our Facebook page, which is Renewal Rehabilitation Center, and we can schedule a consult with you, so I can be able to answer the questions that you have concerns about. And do also realize everybody's journey. It's a journey. It's a journey. No, there is no same book. Everybody's journey is different. It depends on what you had going on before your surgery. It depends on how involved the doctors had to be during your procedure. These are things that definitely take a toll as to how your situation will continue, how your results will be. So definitely keep that in mind. Everybody is different, and your story is a story for you to tell. It's okay to listen to other people. It is okay to Google everything, but take it with a grain of salt and realize everybody's situation is different. But don't be too prideful to ask for help from a medical provider, or too prideful to talk with a buddy who may have been through some things, or who just talk with somebody. The biggest thing is the conversation, and that conversation needs to start with you in your head. It needs to start with you and your loved ones. It needs to start with you and your team of experts who work with this. It starts with you. So again, we thank y'all for tuning in. I will drop our information into the comment section. And again, set up a free consultation. I do free 15-minute consultations if you're needing that. So again, Reverend Odell Cleveland, the man, we thank you for joining us and bringing it from a man's point of view. Thank you for talking about Peter when we talk about Virginia.
Thanks for saving lives.
All right, thank you. Y'all have a good rest of the day, okay? And we'll see you next Tuesday when I talk about pelvic rehab therapy.